Dear friends, I would like to introduce the booth we are trying to exhibit some kind of the total solution for the health care from our partners and professional technologies. And the other is about the platform development from the advanced maths. And the final is about the Pingtung Christian Hospital. We work together to trying to find out some total solution for the AI healthcare system. So in this, I would like to show you how this platform development. Indeed, most of our surface we can just observe about the surface layer, but indeed based on the various fundamental development, including the data layers and information layers. And through this, we organize together and integrate together as in knowledge layers. So indeed, as a user, they can develop their own scenario for the health development. So I think this is very important that through these developments, each partners, they can work on their own basis and context. And then through this, you can see that all our devices are wireless, and through the contact with the Bluetooth or the Wi-Fi. So, and then we can, most of the components of the vital signs, at the moment, including more than 100 devices, can be linked to this platform. So through this, we can find that whenever the patients measure their vital signs, they can immediately install in the app system. So they can load and they can find out their data at their own app. And then through this, the analyze through the AI, and then they can have immediate feedback about their bodily or physical conditions. If there is some extreme data or extreme cases, and they can be informed back to the user. And especially when some of the critical values was found, they can send to the care center to have some questionnaire or to have some feedback to the user. And then you can see that. And whenever the client use these systems, they will collect all their own physical systems, physical vital signs. And then if they want to know more, they can use the interaction between the AI's intelligence system, so they can have the mutual communication together. They can ask the question. Either we have the different language can be used, English, Mandarins, Cantonese, Thais, heavy kinds of the national language can be used in this system. Okay, so it is very user friendly. And then we can see that we have the high tech from the Asia Medical, and through this you can see this is the 3D images. So they can capture. This is a very good education programs in order to introduce how the surgery is done or how the medical procedure is done. And then you can see this apparatus is about the capture of the fundus of the eyes. So they can have a very high artificial intelligence calculating methodologies, so they can estimate and they can give assist screening software for the eye disease, especially for two types of the eye disease. First is the diabetic retinopathy, and the second is about the age macular degenerative disease. So these two eye diseases are very common in the aging people, and especially in the diabetes cases. And then also they have another advantage. They can use a very common chest X-ray to estimate, to use the AI technologies to estimate the bone mass density. So this is a very important part of the sufferings from the elderly people, expressed for the osteoporosis, so they can have an early detection and warning, and also a screening test for that. And the final, you can see that we integrate all these systems together, and in order to provide a better life quality for the elderly. For example, in the community, we also develop the training programs, and we use the machine for the training of the core muscle of the elderly in order to improve. So that's why the AIs can generate what we call the spot prescription. So spot prescription means that under this estimation, we can improve the muscle power and also the balance of the elders. So finally, Pingtung Christian Hospital, through this integration of all the healthcare system in a total solutions, we can give a very elegant the physical examination program for those who apply for that. So we hope that through this integration of all the systems together, we can provide the better what we call the total solution for the life health care.